Hi there, my name is Jessica Broitman, Dr. Jessica Broitman, and I am really pleased that I'm going to be here today to talk to you about psychoanalysis, the talking cure, and what is a psychoanalyst. I'm going to start with telling you that psychoanalysis is defined as a set of psychological theories and therapeutic methods which have their origin in the work and theories of Sigmund Freud. The aim of psychoanalytic psychotherapy is to release repressed emotions and experiences. For example, to make the unconscious conscious in the service of improving mental health. So, psychoanalysis is a method of treating emotional difficulties that involves communication between a psychoanalyst and an individual with the goal of gaining insight into the individual's inner world and how it affects their emotions, behavior, and relationships. It's also a system of ideas about the human mind and personality. And these ideas include the idea that the unconscious part of the mind exercises powerful effects on our feelings, actions, relationships, and endeavors. Unconscious conflicts can cause anxiety, moodiness, depressive thoughts, troubling personality traits, difficulties in work, or difficulties finding and maintaining long-term relationships. Many such problems have their roots in past experiences and relationships. Psychoanalysis seeks to help patients to bring troubling unconscious forces into conscious awareness. And with the insights gained during analysis, a patient can work at improving relationships and productivity, interrupt self-defeating or self-destructive patterns, and perhaps even unlock creative potential. So Sigmund Freud was the most famous person associated with psychoanalysis and is considered the father of psychoanalysis. And Freud was born in Austria in 1856 and spent most of his childhood and adult life in Vienna. He entered medical school and trained to become a neurologist and earned a medical degree in 1881. And soon after his graduation, he set up a private practice and began treating patients with psychological disorders. His attention was captured by a colleague's intriguing experience with a patient. This colleague was Joseph Breuer, and his patient was the famous Anna O, who suffered from physical symptoms with no apparent physical cause. When Dr. Breuer found that her symptoms abated when he helped her recover memories of traumatic experiences that she had repressed or hidden from her conscious mind, Freud's interest in the unconscious mind was sparked, and this spurred the development of some of his most influential ideas, resulting in the birth of psychoanalysis, which I've previously said is defined as the set of psychological theories and therapeutic methods which have their origin in his work. So let's talk about how does psychoanalysis works. A psychoanalysis would occur with an analyst and a patient meeting 3 to 5 times a week. This intensive schedule of one-on-one sessions helps to establish the psychoanalyst's office as a place where a patient can safely and freely associate, that is, talk about whatever comes to their mind, whenever it comes to their mind, and develop a deep bond with the analyst. These frequent meetings also encourage the emergence of a patient's full range of personality traits and behavioral patterns, an important step on the path of self-understanding. The use of the couch, which is a holdover from Freud's days, is no longer required. However, some people find that lying down facilitates free association and helps them to focus their thoughts inward. Others, however, find it much more helpful to sit up at face-to-face with the analyst. But let's review the thoughts behind the use of the rationale for the couch that came from Freud. Freud believed that having a client lie on the couch instead of sitting face-to-face with an analyst would free both participants from the social constraints established by looking at each other. Both would now have an opportunity to let their minds run free in relation to each other. The unconscious communications that can result from this are thought to foster a more profound and intimately deep self-discovery. The couch could be considered a place of freedom in which the patient can explore the deeper aspects of their pains and passions. The couch can be thought to facilitate a greater level of honesty that can aid in the treatment process. It can facilitate self-acceptance and reduce inhibitions. But it is important that a couch is only to be utilized when a patient is ready. There is no pressure or right way to use it, as each particular patient's experience is going to be unique. While it's not necessary for a patient to be in psychoanalysis, it is often recommended and encouraged for optimal results. However, psychoanalysis is a collaborative effort. It has to work for both parties. And as a patient-free associates, the analyst will listen very carefully and help the patient to grasp the underlying unconscious sources for their difficulties. And to encourage this awareness, the analyst will not only interpret the ongoing patterns that they notice, interpretations, of course, that a patient is welcome to amend, to reject, or to supplement, but will also encourage the patient to re-experience them in the safety of the analytic setting. In psychoanalytic parlance, this is known as transference, where the patient can relive their life story by transferring onto the analyst feelings and attitudes that they originally experienced in relationships with other people. So let's talk about what the aims are of psychoanalysis, which are to release repressed emotions and experiences in order to make the unconscious conscious, so that one can free the patient from suffering repetitive, distorted emotions. Classically, the bringing of unconscious thoughts and feelings to consciousness is brought about by encouraging the patient to talk about their dreams and to engage in a free association in which the patients would report their thoughts without reservation and make no attempt to concentrate while doing so. Another important element of psychoanalysis is, of course, the use of transference, the process by which the patient is displacing onto their analyst the feelings and ideas which are derived from their previous figures in their life. The tenets of psychoanalysis suggest that the development of personality is heavily influenced by these events of one's early childhood. In fact, Freud suggested that the personality was largely set in stone by the age of 5. The idea was that bringing information from the unconscious into consciousness can lead to a catharsis, a release, and allow people to then deal with these issues. People will use a number of defensive mechanisms in order to protect themselves from the information that was contained in the unconscious. Emotional and psychological problems, such as depression and anxiety, are often rooted in these conflicts between the conscious and unconscious mind. A skilled analyst can help to bring certain aspects of the unconscious ideas into awareness by using a variety of psychoanalytic strategies, such as dream analysis and free association. The conscious and unconscious mind is a very important concept to understand. The unconscious mind includes all of the things that are outside of our awareness. This could be our early childhood memories, our secret desires, and our hidden drives. According to Freud, the unconscious contains everything that might be unpleasant or even socially unacceptable, because these things could create pain or conflict, so they are buried into our unconscious. And while these thoughts and memories and urges might be outside of our awareness, they continue to influence the way in which we think, we act, and we behave. And in some cases, these things can influence our behavior in very negative ways and lead to psychological distress. The conscious mind is everything that's inside of our awareness, the things that we know and can easily think about and talk about. So we have a series of defense mechanisms, which are strategies that the mind uses to protect themselves against anxiety. These defensive tools act as a safeguard to keep unpleasant or distressing aspects of the unconscious from entering our awareness. When something seems too overwhelming or even inappropriate, a defense mechanism might keep that information from entering our consciousness in order to minimize distress. So you can hear that these are intended to be protective, to actually help one to function better. However, sometimes it gets way out of whack, inappropriately utilized. So let's talk about a psychoanalyst. Who can become a psychoanalyst? And what is a psychoanalyst? So within the field of psychology, a psychoanalyst is one of many types of techniques that one could use within that discipline. Psychoanalysis can take 14 to 16 years for someone to actually study in order to become a psychoanalyst, because you must get certified in order to do so. And a certification program would provide a comprehensive theoretical and practical training in all of the principles of psychoanalysis. And for many years, psychoanalytic training in the United States was only available to medical doctors, while this was never the case elsewhere. And there's a very interesting history on how this was changed quite recently by colleagues of mine. So the American Psychoanalytic Association had an agreement with the International American Psychoanalytic Association dating back from 1939 that denied membership to the International Psychoanalytic Association to any United States analyst or institute that was not also a member of this organization. And only medically trained psychoanalysts were permitted. You must first become a psychiatrist, and then you could become a candidate of an American Psychoanalytic Association. There were a few exceptions made for what was called a lay analysis or lay analysts, and these were primarily people who were involved in research. However, in 1985, quite recently, 4 psychologists that were called members of the Committee for Lay Analysis prepared a lawsuit here in California, where I am based, which prohibited the arbitrary and capricious admission standards for professional training, charging that they had conspired to establish a monopoly on psychoanalysis to stifle competition in violation of federal antitrust laws. As a result of this, they said, was to raise prices charged to patients and insurance companies and others who had to pay for psychoanalysis. Although these charges were denied, the lawsuit was settled in 1988, which then opened the fields to non-MDs. So now there are several reputable psychoanalytic programs that do not require MDs for admission. They do, however, require at least an advanced degree because you must be able to be licensed. So now who can become a psychoanalyst? Any psychologist with a PhD or PsyD, a clinical social worker, an MSW, an MFT, as well as psychiatrists and other MDs are all eligible for training as psychoanalysts. The training includes 4 to 5 years of classes and supervised work with patients, and an aspiring psychoanalyst must undergo a psychoanalytic treatment themselves. These professionals all follow Freud's theories and the other more modern theories that are based on the ideas that painful childhood memories in your unconscious mind are the cause of emotional troubles. I want to tell you a little bit about some of the contemporary theories, and then I'm going to end my presentation with a detailed discussion about my particular favorite form of psychoanalytic theory, which is called control mastery theory. So Freud was a very prolific writer, and in his 22 volumes, he explored all aspects of the human psyche, frequently revisiting his ideas, but he never integrated his later ideas, resulting in a variety of schools which each focus on differing Freudian ideas. Some of them you may have heard of are Jungian, Kleinian, the British school, Lacanian, object relation theorists, self-psychologists, intersubjective psychologists, and the one which I practice from, which is called Weiss's control mastery theory. I'm going to tell you about this type of psychoanalytic relational therapy, which was developed by Joe Weiss in collaboration with Hal Sampson and researched by the San Francisco Psychotherapy Research Group. And a therapist who adopts this approach would assess how well a child is interacting with his environment. They would consider the beliefs that the child is developing about themselves, especially in the context of their family and relations and any processing difficulties. The theories behind control mastery theory assume that the driving force in an individual is to consciously and unconsciously feel safe, find acceptance, and experience a sense of mastery over maladaptive thoughts and behaviors. It emphasizes one's ability to exercise control over one's mental life and one's strong desire to get better. You can hear the emphasis on control and mastery, which led to the title. Adaptation and attachment are seen as the two central organizing principles in the development of an individual's psyche. As one needs their parents for survival, safety, love, and security, one of the best strategies for doing this is to get along with your parents. Therefore, we are all motivated to maintain our ties to our parents. In order to do this, a child works as hard as possible to learn as much as possible about their parents. They infer the moral and ethical principles in relationship to their parents that govern their parents' lives, in which the parents practice with the child and in which the parents expect the child to practice in relationship to them. These childhood experiences are particularly potent agents in creating unconscious beliefs, which lead to ongoing negative experiences and in turn can interfere with the achievement of life goals. My fingers are sticking, so I can't go up there. Starting at a very young age, a child may begin to form an image, self-narrative, and belief about themselves and others that is potentially incoherent and unhealthy. They may often feel confused and anxious about how to respond in a social situation. These types of experiences can give rise to unconscious convictions that as a child, you are at fault for the problems that arise before you. The child's irrational self-blame and unconscious guilt stem from the responsibility they assume for anything bad that happens to themselves or significant others. And these beliefs are extremely powerful. The child's interpersonal experiences, observations, and inferences are the basis of conscious and unconscious beliefs that they use to guide themselves in their daily activities. And they give rise to beliefs and convictions about how one must behave. And some of these beliefs are maladaptive and significantly constrict the child's ability to develop and function successfully in the world. Weiss referred to these as pathogenic beliefs, as they are irrational and illogical explanations about how one's behavior has been affecting and creating all of the difficulties in their lives. Let's back into the tenets of Weiss's theories. Weiss believed that the child's irrational self-blame and unconscious guilt stem from the responsibility that they assume for anything bad that happened to them or their family. And these beliefs are powerful, and they compel one to behave in certain ways or prohibit certain kinds of behaviors. These beliefs warn the child that if they attempt to exercise certain essential functions or reach certain essential goals, they may put themselves in some kind of danger and so risk feeling fear, shame, guilt, loss, or remorse. As these beliefs are always overgeneralized by children, not only to the settings in which the problems occur, but to the world at large, they can significantly influence the child's future personality development. Let me give you an example. A child who's kept close at home may incorrectly believe that their parents wanted them to remain dependent upon them. The family's actual motivation might have been to just protect them from some potential problems. This misunderstanding might cause that child to inhibit their desires to be strong and independent because they believed incorrectly that they would be displeasing their parents if they were to follow their desires to separate. These pathogenic beliefs stem from a number of sources, including identifications with a parent's belief or behavior, or in compliance with what they believe a parent's interpretation of reality was. The kinds of belief that a child develop will depend on the nature of their specific motivation at the time their beliefs were created, and on how the child believed their parent, their teachers, or their peers reacted to those motivations. The child's belief may often be incorrect and exaggerated, or they may be accurate assessments and perceptions of the situation. Patients come into treatment with a plan to overcome these problems, and they will test the therapist in predictable ways during therapy. It is not usually a conscious or a fixed plan, but is much more commonly a tentative, flexible strategy for achieving one's goals. And it is modified and revised as therapy progresses. In fact, a child will often mold their plan, or a patient will mold their plan to a therapist's style, stance, or orientation. In this treatment, patients will test, and a test is an unconscious planned behavior that is an attempt to solicit information from the therapist about their willingness and ability to help the patient carry out their plan for therapy. Tests are going to vary in how discreet and noticeable they are. The testing behavior might just provide an opportunity for therapists to intervene in a helpful way, or it may exert a strong demand for the therapist or psychoanalyst to respond to what the patient is doing or saying or behaving. Some of the tests are barely distinguishable from normal behavior, but some are extremely obvious. Some occur repeatedly or continually throughout the therapy, and they can be passed or failed to varying degrees depending on the analyst's response. Testing is critical. It cannot be avoided. It is the primary way, according to Weiss's theory, in which patients attempt to establish conditions of safety with the therapist or analyst in order to master their childhood traumas, to disconfirm their pathogenic beliefs, to overcome their compliances and identifications, and to acquire the psychological strength that they had lacked, using their analyst's help to pursue their therapeutic goals. There are two kinds of tests that might occur according to the control mastery theory of analysis, and research has identified them. They are transverse testing, pulling for the analyst to treat the patient in the uncomfortable way that the patient had experienced previously in their childhood, or secondly, by turning passive into active, where the patient is going to take the role of the traumatizing parent and act in this way towards the analyst. These tests can co-occur, and they are a way for patients to reevaluate the reality basis for the dangers predicted by their irrational beliefs. It is also often the therapist's best way to understand their patient's emotional experience, because they actually get to feel exactly the feelings that the patients had and they're being generated inside them. And in these tests, a patient will act in accordance to whatever their beliefs are. They'll test in order to find out if the conditions of safety currently occur for them to make these beliefs conscious. For example, if the child thinks that their parent appeared overly worried, they may assume that they must have done something terribly wrong that caused them to worry. To test their belief, they will act particularly worrisome with their analyst, and they will hope that this will in fact not occur and that their analyst will not be worried. The professional calm acceptance and reaction to their patient will help their patient to disconfirm their belief that they, as a worrisome child, caused their parents to worry. And if the analyst responds differently than the patient's parents, they can then disconfirm their belief that they were the cause of the worrying. Over time, with continued testing and successful responses from the analyst, the patient will begin to feel safe and will be much more likely to bring into consciousness, to make the unconscious conscious, the significant events, and to be able to then work more productively. This will allow them to become more aware of what were their unconscious beliefs and whatever impulses, attitudes, goals, or feelings they had repressed in obedience to these beliefs. And typically, a patient will not want to face a core issue until they are reassured that it will be safe for them to do so. For example, a patient who is impaired by a belief that they deserve to be blamed and ridiculed may not remember this, may not allow it to become aware of a part of their consciousness that they were felt very blamed until they have been able to reassure themselves that the analyst will not blame or criticize them in the same manner that they experienced their parent too. In addition to testing, patients also work in analysis by making use of the therapist's interpretations to become more conscious of their unconscious beliefs and to realize that they were false and not helpful. This will increase their control over the effects of these often oldly held beliefs, and then they may become much less constricted and less vulnerable to the types of trauma which they had been exposed to by these beliefs. So the way in which an analyst who believes in the control mastery theory of psychoanalysis would work is very case specific, meaning that it will be critical to consider the specific needs of the person with whom you are dealing with at a particular time. And it will depend upon which belief the patient has developed and which belief they're working on overcoming at the particular time they're with you, and their choice of the way in which they're going to do that. So it's going to require you to look at how the patient is interacting with you and their environment. What are the issues and beliefs that they have developed about themselves based on their issues, and how are they being shared with you? A therapist developing this approach would address these issues by establishing a safe and accepting environment, fostering your patient's understanding of themselves, helping them to experience mastery over their pathogenic beliefs and gain control over their lives. The analyst would encourage a cooperative working relationship between yourself and your patient to disconfirm these pathogenic beliefs. Patients are seen as highly motivated to disconfirm these beliefs in order to recover the capacity to pursue life's goals. And as the analyst responds differently than people from your patient's pasts, they would begin to disconfirm their beliefs that they were the cause of their trauma. For example, when a patient has tested their belief with you that they are the cause of their parents' consistent worry, and they've acted worrisome with you, and you have not responded in the same manner, they would begin to disconfirm their belief that they were the cause of this. Over the time, with continued testing, they will begin to feel safe, and they will be likely to remember the significant events of their past that helped create these traumas. As they become more aware of their beliefs, impulses, attitudes, and goals and feelings that they had repressed, they can move forward. If they were impaired, for example, by this belief that they deserve to be blamed and ridiculed, once they are safe enough to feel like you will not do that, they will be able to remember those previous experiences and move forward to create relationships that will be more healthy and more freeing. So let me just summarize that control mastery theory is a form of analytic therapy or psychoanalysis based on Freud's later ideas that emphasize the cooperative working relationship between an analyst or a therapist and a patient to disconfirm their pathogenic beliefs. Patients are highly motivated to disconfirm these beliefs in order to recover the capacity to pursue their lives' goals. This orientation is applicable to all types of treatment and all kinds of patients in both psychoanalysis and psychotherapy. Weiss and Sampson and his followers believe that everyone tests each other as a means of developing and refining our beliefs about ourselves and others. Understanding that the feelings that we experience when relating to our parents and our patients or communications can be extremely helpful. These feelings, even though they are often difficult to endure, can offer us direct access to our patient's inner world. They are the tests that our patients are bringing forward for us to share with us what's unconscious in their minds. If you can conceptualize and at these interactions as tests and methods of communication and inducing feelings inside yourself, you can then better endure them. You can remain sensitive to your patient's needs and act in a way that will promote their feelings of emotional safety, leading to their mental health. I hope this has helped you to understand a little bit about the origins of psychoanalysis, the basic tenets of psychoanalysis, psychoanalysis, and I've given you quite a bit of description of a particular type of psychoanalysis, which I personally practice here in Berkeley, California. Thank you very much.